All right, welcome back to Pharmacist on Call. Your host, Dr. Sean Pruitt, your community pharmacist. All right, we're going to get back into cold versus flu. So we're upon that season, and people are getting sick. They're going to the pharmacies everywhere. So just to give you kind of a baseline of what your symptoms look like, and you'll be able to tell your doctor or your nurse practitioner what's going on with you. So as I said, cold caused by the rhinovirus, and the main difference is, what symptoms you will have and their intensity. So with your cold, you will be more likely to have a runny nose versus the flu. You'll be more likely to have some sinus congestion versus the flu. You'll have some milder symptoms in terms of the fatigue. The flu has an insidious onset, which means, boom, it hits you quickly. So you feel that heavy fatigue, you feel what we call malaise, the body aches. With a cold, you don't get that so much, so the symptoms are not that severe. You will get a sore throat with both, but it'll probably be more common with your flu. In terms of, like I said, the body aches and just the extreme fatigue, that's going to be your flu. And then in terms of how you treat them, you can do the cold with maybe something like an antihistamine, being that it's from the rhinovirus. You can Claritin, your Zyrtec, your Benadryls, and if you need it, maybe a cough suppressant of some sort. In terms of the flu, you're going to need something multi-symptom because you're going to be dealing with fever, body aches, sore throat, probably coughing and everything else. So you'll need something multi-symptom that covers your pain and your fever. And most products are going to be like either your Theraflus or your NyQuils, things of that nature. So how do you prevent from even getting it all together? Your best thing is just to, wash your hands, especially when you touch doors, the pipes at the gas station, anywhere where you're in public, even the buggies at your grocery store. Make sure you use the wipes. Make sure you keep some hand sanitizer near you, but wash your hands every time you touch something, that is deemed community accessible. And then you can also do some prophylactic things to help yourself. Vitamin C, you can take about 500 to 1,000 milligrams twice a day, maybe 3 times a day. Vitamin D is huge for cold flu season. Actually, for flu, it helps stimulate the immune system, and some research even shows that it has a direct effect against the flu virus. So that route, you want to go maybe 5,000 international units once a day. Or for some of those of you who have, thyroid or vitamin D deficiencies, you're doing 5,000 units weekly. So you can go that route. So vitamin D, vitamin C, you certainly want to use to strengthen your immune system. Echinacea is another good one. Oil of oregano, olive leaf extract. So these are all good things that once you do get sick, if you want to go natural, to kind of help, stave off the symptoms of the flu. So. Also wanted to get into, this is not talked about a lot, but just pharmacy etiquette and how you should handle your medication. So I wanted to talk about 2 or 3, do's or don'ts with your medication. So what you should do is take your medication as prescribed by your doctor. So what happens a lot of times is we will take our medications and we will make judgments on it quickly. And if you can remember the discussion from Linda, she took that turmeric for 2 months before she really got a maximum effect out of it. So you're going to have to stay the course with your drug therapy and not take it kind of piecemeal or as needed when it's something that's supposed to be taken routinely or on schedule. What you should not do is stop taking your medication. So if you have hypertension or diabetes and the medication kind of gives you some side effects, certainly report these to your pharmacist or your doctor, but depending on how tolerable they are, you should probably try to continue your drug therapy. If it's some stomach discomfort versus diabetes, I think that you would kind of want to grin and bear it and maybe put a little something on your stomach, and talking about metformin because it's notorious for causing GI upset. Unless you can, but again, communicate with your doctor to let them know that you're having trouble with these medications. Don't just stop. And I talked to a number of people who will stop their drug therapy, and of course they run into problems. The other thing that you should do is keep your medication out of the reach of children and other family members. So it should not be accessible to, it's not community property, so only you should know where it is. So what happens is people will find out you have medication, and especially pain medication, and then you have an issue there where they could either hurt themselves or worse. But what you should not do is give your medication away to family members. So you got some antibiotics from the dentist or from the doctor, you took your amoxicillin for 3 or 4 days, you're starting to feel better, and hey, I think I'll just put these puppies up. Your child or family member says, hey man, I'm feeling sick. Hey, I got some amoxicillin in the cabinet. Well, no, don't give it to them. Because we don't know what virus or bacteria that we're treating, and you could create a situation of drug resistance. So if you haven't cultured anything, the antibiotic may be inappropriate for them. And also, you don't know if this person has a drug allergy or not. So do not share your medication. This is another biggie that we deal with. At the every pharmacy deals with it. So make sure you're not sharing your medication. Do not sell your medication either. So your medication is for you. It's called diversion, by the way, and it's illegal. So you should not sell your medication. There's nothing right about that. So make sure you keep yourself out of the out of the crosshairs of law enforcement. Again, that's called diversion, and it contributes to the problem on the streets. So do not sell your medication. And what you should do is keep your medication, like I said, sequestered, maybe in a lockbox or a safe, especially if you suspect theft, in your family. If you do have any problems with your medication, make sure that you do report this to your pharmacist or your physician so that they can take appropriate steps. Again, do not discontinue medication on your own, because what's going to happen is your blood pressure, your diabetes, or whatever the situation is going to get worse. It was helping you, but because of the side effects, or you decided to stop it, you no longer have that cushion of protection that the drug afforded you. So if the side effects are intolerable, let your doctor know so that they can change it, okay? All right, so those are the do's and don'ts. If you have any other questions about that, then certainly feel free to call in. We're going to get into some supplements right now. So I brought my buddies here. The first one is beetroot juice. So you've heard some people talk about it a lot. And what beetroot juice does, it is our natural treatment for hypertension and diabetes. Now, this juice comes from the root of the beet. It's organic, non-GMO, all of that good stuff. So what you do is you take a capful, shake it up real good on an empty stomach before your medication or your meals or anything, and if you need another dose in the afternoon before any meals. So what is this stuff good for, Dr. Pruitt? Well, it's good for hypertension. The way it works in hypertension is that it's a vasodilator, which means it opens up your blood vessels, and if your heart is having to contract against blood vessels that are very narrow, it opens it up so that the heart does not work as hard to get that blood flowing through your body. And once you decrease the amount of work the heart has to do, the blood pressure goes down. So vasodilator lowers your blood pressure, and it does this quickly. I became a believer in this when I had a number of guys who were trying to pass their DOT physicals, and they could not. And these were people who are already on blood pressure medication. So I decided to try this in them as a natural remedy, and they have all passed their DOT physicals. In fact, one told me he took this 30 minutes before his test, and he was in normal range for the first time in a while. So this stuff is really good. It does its thing quickly. It doesn't take a long time. You have 30 minutes, 45 minutes. It is lowering your blood pressure to normal. It's also good for diabetics. I'm assuming that it helps repair the pancreas to the point that it can start kicking out its own insulin, that it increases insulin sensitivity so that your body can use it. And we had a number of patients whose A1Cs and fasting blood sugars have gone down. So our patients with hypertension and diabetes, getting down to the point where they no longer even need the medication. They could just really do this. So this is also good for a number of other things. It's good for those of you ladies and men who suffer from anemia. This is rich in iron. And so for those of you low iron, lack of energy, This stuff is teeming with iron. For those of you who suffer from constipation, it is loaded with natural fibers that can scrape the colon walls and help clean you out. You know, beetroot juice is good for that. It is also good for helping with many organs, your kidneys, your liver. It has a substance in it called betaine, B-E-T-A-I-N-E, which is a detoxifier, and a liver protectant. And so betaine, beetroot juice, very good for helping the liver out as well. So I would recommend this if you got a number of issues: pancreas, liver, kidney, diabetes, hypertension, low iron. This stuff pretty much does it all. It does about 20 things from what I read. We just primarily promote the hypertension and the diabetes piece. All right, so we've got our next friend, and I talked about this earlier. So this is for those of you insomniacs out there who are having trouble sleeping. This is GABA. This is gamma aminobutyric acid. And if those of you who have heard of Xanax or Valium or Klonopin, this is our natural Klonopin, Xanax, Valium. So it works in the same receptors, the GABA receptors. And what this does, so once it attaches to those, it gives us that anxiety relief sensation, but it also induces sleep, like, whew. So I take this, and 30 minutes later, I'm about ready to go to bed. And so I sleep thoroughly throughout the night. And if I have to get up in the middle of the night to use the bathroom and I try to think about whatever was bothering me, it's weird. This stuff won't let me do it. It will take it off my mind, and I go right back to bed. So those of you who are having insomnia, I highly recommend GABA. But the thing with it is you have to be careful, because there are a lot of foods that decrease the effect of GABA, certainly seafood and dairy products being one. So you have to avoid those foods while you're taking GABA, because they can limit the effect that it has. But GABA, love it, stand by it. So those of you having insomnia, check this out. Another thing that you can check out as well is passion flower, and it's good at relieving anxiety as well and inducing sleep. And then we've got our good friend for you older gentlemen out there, saw palmetto. But hey, it looks like we're up on a break, so we'll be right back. Stay right there.